Good health is the key to successful living. It has an impact on our everyday life, whether we're at home, at work, on a sports field, or in a gym. I'm with Sham Zaman today. He's a health trainer with the Osmani Trust, and we're talking about some fascinating projects that they're delivering within the community. Thank you for joining me, Sham.
Thank you for having me.
I understand that Osmani Trust have now been delivering projects for, well, this is their 10th year now.
Well, in particular, the Health Trainers Program this is our 10th year. It started way back in 2007 as a pilot program in Tower Hamlets. It was only one of 2 or 3 pilot programs up and down the country. Thereafter, through the success of the program, it got rolled up and down the country, and it's now a national program.
It's gone national now as well.
National. There are many programs within the NHS, the Primary Care Trust, in particular in Tower Hamlets, is where within the local authority.
What does the health program entail?
Well, the Health Trainers Program is a healthy lifestyle program which helps people with making small changes but making significant differences in their life. We help people with exercise, physical activities, healthy eating, personal health plans, weight loss, reduction in alcohol, smoking cessation, stop smoking services. So, alongside that, we also help people with it's known as wider determinants. You might call it someone's health within housing, what job they're in, their training, education, everything that surrounds them, the local community. It has an impact with one's health. And
is it an inclusive program?
Well, the program is inclusive. If you live or work in Tower Hamlets and you're over the age of 18, you qualify for the program. So it's very inclusive. As well as generic clients that we sort of work with, we also work with mental health. So we work with people with mental health issues, which have mild to moderate issues, and we help as anyone else with their physical activities, healthy eating. We do personal health plans as well. A new area that we're working in recently is an area of innovation, work with disabilities. To be inclusive, you have to work with everyone. So we work with disabilities in terms of the physical activity, again, the healthy eating. So it's been piloted at the moment, and hopefully it gets rolled out within Tower Hamlets and then hopefully up and down the country.
So working with disabled customers, for example, would it involve a little bit of one-to-one and a little bit of group session just to keep them all included within?
So the Health Trainers Program comes in 3 levels. So level 1 is recruiting people to the program. We go out in the community holding information stalls, going where there are high footfalls like GP surgeries, idea stores and other community centres. We also get referrals from GPs, other health professionals within the hospitals, the NHS Trust, from other local community groups, as well as people can simply just walk into our centre and inquire about the Health Trainers Program and then join the program.
For further information, viewers can visit www.osmanitrust.org. There's a whole plethora of information and a lot of information and resources available there. There's contact numbers and the address as well. So that's www.osmanitrust.org. Right, getting back to the work that you're doing, you recently had a really good health expo. You want to share a little bit with us?
Well, viewers may be wondering why we're wearing
all these nice t-shirts.
We had the Health Expo a couple of weeks back on the 14th of July, Thursday. It's our marquee event. The idea is to get health professionals under one roof to give the local community within Tower Hamlets access to services within the locality. They can come and inquire about various services like stop smoking, mental health, like Compass, who work with mental health and well-being, Look Ahead, other disability groups, all sorts of organizations come under one roof. we had around 300 people plus turning up to the event, which is fantastic for Osmani Trust and the health trainers program, supported by the local community, as well as 30 plus stall holders showcasing their sort of organizations.
So it was very much a community event. I mean, I didn't know a lot of the things that you mentioned. There was so not only did you have information being imparted, shared, so you took questions from, like, general members of the public who had concerns. You probably had registration for people who wanted to sign up for programs as well, but you also had stall holders. So people actually came in as stakeholders because they wanted to be part of a health expo where not only did they feel that they could contribute something as well, but they wanted to be part of it as well.
Yeah, naturally working within the community for around 10 years now, we have got a huge network of health professionals and access to services that we know about. It's relaying that information to the general public to sort of access the services for themselves, as well as stall holders and organisations showcasing their organisations. We have free massage therapy. It's basically a free event for the local community.
Great. Now, looking back at the work that you do and your experience and your knowledge of the local area, like myself, you're a local lad. What do you consider to be major ailments or illnesses or even conditions, whether they're mental or physical, which affect the people that you work with?
It's well known throughout our hamlets that it's a deprived borough, but we are very fortunate to have many sort of organisations working with different parts of one's health. Some of the conditions that we work with are cardiovascular disease, heart conditions, diabetes, and the like. We don't directly work with the condition itself, but we help to sort of control those conditions. It's been proven that such as diabetes, doing regular physical activity as well as controlling one's diet can actually help sort of control the condition. So it's mainly a prevention program, but if people do have sort of conditions, we sort of support them within our remit, of course, healthy eating, exercise, and the like. Some of the things that we can't directly help support with, we know services that can. So we actually signpost people to specialist services that that can help them and support them.
So this knowledge is invaluable.
Of course, yeah. So we're like a health hub, if you like, within the local community. And then people come to us to seeking advice of what do I do with this and that.
This one may seem like a bit of an obvious question, but how important or how big is the role of a health trainer when it comes to, say, being a role model?
Actually, it's vitally important. People look up to you as a health trainer. We actually like to think that we eat, sleep, and breathe health training. Because if we're not up to scratch, people won't look up to you. So we actually strive ourselves to become healthier ourselves, to sort of, and then relay that information to the general public. Walking down the street, going home and coming back to work, people do stop you on the street and seek advice, and it's a very popular program, the health trainers program.
So you as a personal trainer, in terms of your personal development, you must surely be reading and watching videos and just making sure your knowledge and training methods are always up to date, because it's always changing, isn't it?
I mean, new studies are being done all the time, and it's vitally important to sort of keep up to date with the health information that the local authority, the Hamlet's Public Health sort of provide, as well as nationally from the government. So training and development is vitally important to keep up to scratch with all the health information, because you are actually dealing with public, and it's important to sort of give the right advice and the right information.
Tell us a little bit about your team, who they are, how many, how you came together, any interesting stories?
Well, at the moment we're a team of 6. We're headed by our program manager, Sham She came in recently. There are a couple of health trainers, myself, Zaman, and Shajui Begum, who's been here since the beginning. So we're known probably as the originals.
Well, it's original veterans.
Yeah, if you like. And then some of the new people that joined it's been a year. So Alan Malia, who's recently joined us.
Is this Alan Malia, who's very generously donated footballs to my under-12s at Stepney Football Club?
I mean, health trainers are always involved in local community. We always like to give back as well. So he kindly donated some footballs.
Fantastic.
Well. So Azia, and we've got two new health trainers, Jay Daniels and Rebecca Chowdhury. They're fantastically sort of helping the community. We also get massive support from our funders. Our locality manager, Brenda Scotland, who supports us immensely. We actually concentrate on the northwest locality of this borough, covering Weavers, Spitalfields, Bangor Town, and that area.
Sham, you personally, I'm not asking you as a from your organisation point of view, how do you measure success, whether you're working with an individual client who may have just come up to you once for one piece of advice, or a group that you've been working with doing sessions for over a period of time? Do you have a marker yourself thinking, right, I feel really good today because I think I've really got through to an individual or a group, or I've made some progression, positive progression with someone?
Any sort of contact with the local community is actually immensely satisfying work that we do. If you can make small changes to one's health to make big differences, so just like changing someone's health diet, if you like, just incorporating 5 fruits and vegetables a day.
Sure.
I mean, that's immense. So one of the things that we do is educate people via workshop. So we deal with healthy eating, smoking cessation, how to make. We do also food workshops as well. We do cook and eats. So any sort of impact that we have with the local community is actually great. There's not such a marker because every individual is different, and every individual will come with different baggages, if you like.
Sure.
And so that's very satisfying in terms of working with the local community, because I am actually from that community itself.
And does it feel more satisfying for you, for someone who's born and brought up in the borough, still living here as well, the impact you and your colleagues are having on such an important and vital issue as health and people's lives on a daily basis? Does it mean a lot to you?
I mean, it means so much, because being from the community and having an opportunity to give something back, I think that's invaluable. As well as people see you as a role model, and the Health Trainers Program is a fantastic sort of a vehicle to give something back to the community.
Does it involve a lot of study and hard work to become a health trainer?
We actually, it's a very specialist role. We actually studied with the Royal Society for Public Health, level 3 health training course, which is specifically designed for this program.
Fantastic. I hope you've enjoyed listening to Sham as much as I have as well. As I've mentioned earlier in the show, if you would like further information, the best place to visit is www.osmanitrust.org. Thanks for watching The Sports Show.